transplant patients should definitely get a third shot. And who knows later on if they may even need a fourth shot. We know that immunity in transplant patients is marginal at best. So what can you do? You can give a third shot and boost their immunity. Immunocompromised or immunosuppressed patients need a third shot because they don't have the robust response that you and I would have to a vaccine. And we've seen this with other vaccines. And we know because the medicines they're on prevent them from having a rejection, and in this case, it prevents them from having a response to a vaccine. As you get further away from a transplant, you're on less of these medicines, so years later, those people have a better response. But early on, many of the patients have zero response. Good question is it safe for transplant patients to receive a vaccine? And the answer is yes. The worry is that a vaccine might cause a rejection. There's been no proof of that because vaccines by design increase and improve the immune system to whatever it is. And could there be a spillover to rejection? There is none. So we've proven that, we've seen that, we've vaccinated thousands of people who have had transplants, no rejection. So I think it's important to note that with this third dose, it's the same vaccine that you saw dose 1 and 2 of. So if you had the Pfizer, you take the Pfizer again. If you had Moderna, you took Moderna again. It's a new modality, mRNA, and now proven in millions, hundreds of millions of people to be safe with very few side effects. It was safe at the beginning, it's safe now. The type of vaccine is important. We have only recommended mRNA vaccines. That's either Moderna or Pfizer for the transplant population. We believe the J&J vaccine is single dose and its type, its modality was not going to be appropriate for transplant recipients. And if you had Pfizer, take a Pfizer shot for the booster. If you had Moderna, take the Moderna shot. Their mortality is exceedingly high if they get COVID. So it's still very important for everyone and the transplant recipients to mask, to social distance, even if you get the vaccine. Now with the Delta variant, we know that this is very aggressive. We know it's critical, and we've been watching our transplant recipients get sick. We have the ability to treat now, which we didn't have 18 months ago. And as soon as a transplant recipient becomes positive, I can't emphasize this enough, let your transplant doctors and nurses know if you test positive and we can treat. And the way to treat is to give an infusion of the monoclonal. It'll keep you out of the hospital. If you don't get that, you'll get sick. And that's what we're seeing. The mortality was very high before. Without treatment, without a vaccine on board, the mortality will be very high again.